We started this conversation about values and principles, and I really want to go back to that. I think the beauty of the Tarrytown meetings is the opportunity to build on each other's thinking, to ask ourselves and each other hard questions. And while many of us believe that we share common values, we have not yet articulated what those values are. And in fact, several times during the past 3 days, someone has said, we're starting in the middle of the conversation. And as an advocate, I can say that happens all the time. We often find ourselves in the middle of a conversation. Conditions force us to act. But we always have to ask ourselves, even if we're only taking baby incremental steps, are they really taking us where we want to go? Are they leading us into a blind canyon, which is my favorite cowboy analogy? Or even worse, are short-term gains really going to lead us to long-term setbacks? I think the issues on which we work evoke some of the most basic civil society closely held values, things like autonomy, freedom, dignity, equality, social justice. And human genetic biotechnologies really require us to explore the tensions and the conflicts within those values. I have more questions, I think, than I have answers. Where's the line between autonomy and exploitation? Are there limits to what I can do with my body? Is there a difference between sex workers and surrogates? Okay, but because I'm an activist, I have to ask, once we've figured out where we're going, how do we get there? And I want to offer 3 thoughts. One is, first we have to articulate a positive vision, not just what we're against and what worries us, although I'm terrified by all the things that Dorothy spoke about, but what do we want the world to look like? So, for example, instead of talking about the regulation of surrogacy, we talk about the regulation of surrogacy as a civil good, not as a restriction on reproductive rights. Second, we have to figure out how we communicate what we care about. And I kind of want to rehabilitate messaging after the session. Messaging is not lying. Messaging is not being false. Messaging is figuring out how to communicate. Human, biogenetic technologies. No wonder Eric's family can't understand what he works on. So I think we really have to think about how do we talk to other people about what we care about. And the third thing, I think we want to think about how we impact the work that our other allies and colleagues are doing right now. I think some of our work really sounds like it's the future, but we know it's now. And I actually think of Patricia Williams' concentric circles as sort of ripples in the pond. How do we connect with people who are working on racial disparities? Health and racial disparities. How do we change their framework so that they're not racializing biology? I think the lawsuit around the gene patents is a perfect example of engaging women's health folks who, believe me, if you've called them up and said would you like to be involved in a lawsuit on gene patents? They'd say, we don't do gene patents. But if we help them understand the relationship of right, Judy's going, yeah. We help them understand the relationship of gene patents to women's health. Now we have a whole community that's engaged and sharing the values and the things that we work on. Certainly the work on the DNA criminal database is another example. In the abortion fight, the right wing has already done this for us because they're trying to ban abortions based on sex and race selection, even though we know nobody can do race selection. It's a myth, so they're already laying out connections for the reproductive rights community. And last, I want to talk about sustainability. This is a very nascent movement that we're building. Each of us in our organizations, in our studies, in our research, many of us have been doing this work for a long time, but the idea that we are building a movement, we are just at the beginning. And while CGS and their funders have been very generous to commit to 3 meetings, it's an awful lot of work. I think we need to challenge ourselves on how we keep this going. I think the conversations are rich. The work that comes out of it is incrementally enhanced. And I can tell you, just as an example, I'm part of an annual low-income health advocates conference that's been going on for 25 years. And it's about building relationships, it's about new developments, it's about continuing to move the work forward. And I really challenge all of us to think creatively about funding and resources so that we can, in another 20 years, look around a room and the old ones of us will be gone and the emerging leaders will all be sitting up here. And we will continue to share knowledge and address new challenges and opportunities and renew our spirits and our energies. And so I really would like us to work together toward that goal. And then in closing, I just want to thank not only CGS, but I want to thank each one of you because I feel privileged to be part of what happens here at Tarrytown and past Tarrytown, and I've enjoyed every conversation that I've had, so thank you all.